Hi.
Good morning, or actually
Good,
good evening. How are
good
you?
evening here. How are you? How's everything?
Everything is great. I was really looking forward to this.
Same here.
Sorry,
And by the way, I just realized it was daylight saving yesterday, so I was on the wrong time. It seems I always have the wrong time between the States and here with the time difference. I'm always
it's
either an
all
hour
good.
early or an hour late.
It's all good. It's all good. You caught me at a great time. It's nice and rainy outside. I don't have to
Amazing.
rush into work. I get to have a lovely conversation with you. Um, I've heard so much about you,
Thank
and
you.
really looking forward to talking and really educating your audience about everything that we do and everything that's available to us in the world.
Honestly, I really miss your part of the world. It's been so long since I've been to the States. I actually studied in Boston. So
Oh, wow.
yeah,
Wow.
it's been some time. I did my bachelor's and my master's there. So and I used to always come to LA, but I'm more of an East Coaster, so
Well, we are dying to see anyone visiting us and get
trust
the
me, we
world
want to
back
come.
to the
Us
Ovary.
Saudis, we're not allowed to travel. It's been almost a year and a half right now.
Wow. Well, things are getting a little bit better here, so I'm hoping that things will change rather quickly,
Yeah,
and we'll be perfectly good to move forward and have welcome you guys back into the United States and into
hopefully
our
soon.
clinic. Yeah, our
So
clinic, about 25 to 30% of my clinic were all international patients coming to us from all over. So it's been a little quiet there, but the most interesting thing is that we were busier last year than any year we've ever had because there's so many people, Americans, that are now sitting tight, working from home, not traveling nonstop. So we actually had more people that were just like, okay, this is a good time to address my fertility and doing services than made up for all of our sadly international friends that we missed during the year.
yeah, it's also a good time for people to come. Like, when people are always so busy, I don't think they ever thought of kids as much. I think now they have the time. A lot of people are working from home, so it was more of a time to think of conceiving.
Very much so. It's a very interesting, but yes, people aren't doing much. Like, I'm not doing anything. Maybe I should have that baby or freeze those eggs that I've been thinking about for so long.
Exactly. And this is why I really thought this topic, I saw you on Caroline is someone I know, and I saw you on her podcast, and I was like, you know what, I really have to interview him because also, in our part of the world, it's very like, not very common to talk about many things that are very now normal to talk about, but I feel like we should discuss such things. And so let's start first by introducing you. So tell us a bit about yourself and about your
Sure.
practice.
So I'm Dr. Shahin Ghadir. I'm one of the partners at Southern California Reproductive Center. We're the premier fertility practice on the west coast of the United States, and our office is in the heart of Beverly Hills. For many people that have come to Beverly Hills as tourists, we're about a 2-minute walk from Rodeo Drive. We're three blocks over, right in the heart of the city. We have the largest IVF center on the west coast. All of the doctors from Cedars-Sinai, all of the doctors from UCLA Medical Center, which are the two biggest hospitals in our area, along with about 29 other doctors in the community, use our IVF lab to do all of their procedures because it has one of the highest success rates in the country, and we're very, very proud of that.
Okay, that's amazing. And
A little something though, when you say you're part of the world, I was born here. My parents are both Iranian, and
yeah, I
after
know
I
from the
went
name,
here,
Shahin
yeah,
Ghadir. Like you don't even have
very,
to tell
very,
me.
it's a very, very, very not all American name. My sister got lucky with the name Michelle. I got stuck with Shaheen, but it's okay.
By the way, our part of the world, Iran and the Middle East, no, there was always our names. Our names will always be stuck to our origins. They never change them. The boy always has to have the girl. They change the name, but the boy always has to have like the grandfather or someone's name. I'm sure your
Yeah,
name is after someone in the family, right?
actually, I don't think so, but I hopefully I will assume it was B, but I don't know of any other person with that
So
name.
your family definitely moved to Los Angeles after the revolution, right?
So my dad went to school here, and my parents used to live here. They moved. My dad went to Iran, got married, moved back with my mom. My sister and I were both. They were East Coasters. My dad went to
Okay.
George Washington University,
Small
and then
world.
they decided to move to the West Coast. So they moved
Okay.
to the West Coast. My sister and I were both born here, and after I was a few months old, after years of living here, my mom said to my dad, "Enough. I need my family. I need to go back to our life." So they moved back to Iran. According to them, they had 5 of the most prosperous years of their life. And in 1978, they moved back to the United States because they had to just literally run and leave every single thing of ours behind.
Like most Persians in LA, I think that's the case with most of the people
Yeah.
that lived in Iran during that time. It's sad. You know, a lot of Arabs here in this part of the world are originally Persian. You know that, right?
I've heard a lot
Yeah,
about
many.
that.
Like we have families like Farsi, we have Deshti. They're all Persian of Persian origin, and some of them even speak the language still, but not all.
Oh, wow. That's it.
Yeah, yeah.
I speak the language.
Ah, you do? It's obvious because all Persians speak. You know, a lot of the people lose the identity of the language, but or
Right.
even when they live in the States. But all Persians speak the language, and it's a beautiful language. By the way, even in like Bahrain, because my husband's from Kuwait as well, so they all speak. A lot of them speak Persian till today.
Wow, that's
It's a
amazing.
very rich culture, so why would you know what I mean? It's nice to keep it.
Yeah, and I grew up, my best friends growing up were Lebanese since I was a child. So I was in their home more I was than in my own home growing up. So I'm very, very,
Really?
very familiar with the Lebanese
The
culture.
Lebanese culture.
And a lot of, yes, my wife asked me today, your dream has come true. Are you going to do this interview in Arabic? Because
But do you speak Arabic or not really?
أنا بحكي عربي شوية.
Shway. Okay, not bad.
Very.
Very little. And is
No,
your
I
wife
don't.
also a
I
Persian
wish
origin?
I did. My wife's parents are both Persian. She was born here, never been to Iran, but she
Okay.
also speaks Farsi fluently. So
Okay.
thanks to all of our grandparents. The sad thing is that my kids no longer are really speaking Farsi because my parents speak English fluently. So
Yeah.
we have Farsi teacher coming to the house because we don't want to lose that aspect.
Trust me, even my son right now, it's hard to get him to speak Arabic, and because he goes to a school that has a teacher that's English, you know what I mean? And it's
Oh,
just, I think
well,
it's the trend nowadays. It's kind of hard.
I know. Well, let's
But
talk a little bit about
yeah.
some important topics that mean a lot to me.
Okay, so let's start about talking about that. Let's start about, I know you started I know you started, you studied psychology in the beginning, your bachelor's.
I did. I graduated from UCLA with an undergraduate degree in psychology. And then when I proceeded to medical school, I realized, wow, there's a lot of sick people here in the hospital. And it was something that I didn't love, being around very sick people. And I was like, you know what? My own personality is the first thing I tell all young people to look into when they're trying to find their path, is to see what they are about. And I am someone who doesn't like to be around tons of sad things, likes really in the more pleasant aspects of life. I decided to do obstetrics and gynecology, which I absolutely loved. And while I was doing obstetrics and gynecology, I did a 1 month rotation in the area of fertility, and I realized this is for me. It is one of the most rapidly advancing areas in medicine. It is one of the most interesting areas. It is one of the most, I hate to say it this way, but I feel more fortunate sometimes than the patients because I get to do such amazing things in my life that give me such satisfaction and mean the world to me. So fertility became my passion and my dream. I applied for fellowship, and those two hospitals, both UCLA and Cedars, is where I trained and I did my fertility training. And during those years that I was doing my fertility training, we work at Southern California Reproductive Center for 6 months. After a couple of weeks, my partner said to me, would you like to join our group? And I've been in the same group as a partner since the second I started my fellowship program and the day I graduated.
Amazing.
And it's been a great group. We have some of the best science that's available in the entire world. Our lab consists of, I think, over 15 embryologists, and some of them are PhDs and world renowned. Our lab director is one of the most brilliant people in the world. And this is why I find it to be incredibly important and worthwhile for many people that don't have this kind of science in their area where they live, to make sure that they're able to do fertility treatments in places that are very reputable, and it won't be a waste of time.
The question is, like, you know, you hear a lot of stories like this is her 6th IVF treatment, this is her 4th IVF treatment. When you get a client that comes after her 3rd IVF, do you still continue doing it if it doesn't work the first 3 times? Or are there clients that you say it doesn't work, or it's impossible, you should get a surrogate? Of course, in our part of the world, the surrogacy is not an option for
Right.
religious reasons.
Right. So we've had I've had many patients come and visit us from the Arab world. We've had many members of the royal family people from all of the countries come to our clinic. Now, so this is what happens when, and by the way, it's not just the same in the Middle East, but right before the pandemic, I was in Australia. We were launching our website there and all of the things that we were doing, because we had a lot of Australian patients, and like one of the country's most famous Olympic athletes was my patient, so talked about it, and it brought a lot of recognition to our clinic. I was meeting people that had done 15 and 16 IVF cycles. And that begins to tell me that the science in some places is not that good. And the last time I had a patient in my office do more than 3 IVF cycles, I really just don't even remember. One of the reasons is that after 3 cycles of IVF in a very good clinic, you can really understand the truth of what is happening. So we're able to tell patients, you know, I think you have a problem with egg quality, or I think you have a problem with sperm quality. But most of the time, within 3 cycles, our patients are pregnant and they're able to make an embryo. We do a lot of genetic testing on embryos, so that allows us to know at the end of the cycle if they were able to make a genetically normal embryo or not. And what that does is that once we have the genetically normal embryo, even if it's one, like I have a 45-year-old patient, she made only 1 genetically normal embryo, but the chance of success then jumps to 76 to 84%. And we've had that happen multiple times where someone just
at 45 years old.
Yes, it doesn't matter the age of the person. It matters the well-being of the embryo. So as long as you're able to make just 1 genetically normal embryo, at that point, you're able to have an amazing chance of success with implantation. Now, is it easy to make an embryo at 45? No. I told her, I said, you are very, very lucky that you made that embryo. You are beyond lucky that you did well. You are beyond lucky that this went well. So that's something that's really important to be very honest about as well, because not every 45-year-old is able to do so. You know, for many of our patients, we're trying to just encourage people to freeze their eggs at a younger age, so they'll never, ever be in this situation, of being 45 and not knowing what's going to happen in their future with their fertility. And women around the world
just a question, doctor.
Yes.
In the general, usually they say, like, I'm 37, for example. So when I had my first son, I was 35. So they asked me, they said I was already on the high risk pregnancy.
Yes.
I'm in the, what do they call it? There's a name for it.
Advanced maternal age.
Advanced maternal age. So in the Middle East, usually everybody gets married usually early, but now it's been changing. So women are having kids in their 30s. We're becoming a bit more like, you know, Europe and the States, because we're getting married at a later age. Is it also the same thing for women above 35 or 36 or that age group to also have difficulty getting pregnant, or it's not really, it's fine?
Every single person is different. Right now, I have a 33-year-old woman, for example, one of my patients, who's having a major difficulty. She only makes like 3-4 eggs at a time, and her egg quality is really poor, and she makes really poor embryos. So it really, really is different from person to person. There's very simple tests that you can do that tells you a rough idea of your egg reserve. It's called AMH, anti-Mullerian hormone. It's available now in almost every single country. It's the #1 blood test that has changed the way we practice fertility. AMH is super important. If you're not sure if you've got a lot of eggs or you have little eggs, doing the AMH test may give you a really good understanding. If someone's doctor is not really aware of how to understand the result, we're doing phone consultations around the world all the time. And during the pandemic, I was doing more consultations around the world than I ever was, with people at home trying to address the most important things. So I think assessing your fertility is the first and most important thing that someone should be doing.
You got a question that's interesting here about blocked tubes, and if you can stand the chance of pregnancy after adhesolysis. I don't know what that is.
Adhesiolysis. So the question is basically saying, if you have blocked fallopian tubes, and adhesions are scar tissue. So if they remove the scar tissue, will it open first of all, just because once fallopian tubes get blocked, they are really damaged. And it doesn't, in opening them again, whether it's by removing adhesions, which are scar tissue in the area, or somehow opening the fallopian tube, in my opinion, is actually a very dangerous thing, because what it does is you have these fallopian tubes that are now open but not functioning perfectly well. And it allows for what's called an ectopic pregnancy. When you can conceive and the pregnancy gets stuck in the fallopian tube because the fallopian tube is not working perfectly and it cannot get back into the uterus to implant itself, and then gets stuck and implants in the fallopian tube, which is a very dangerous thing called ectopic pregnancy.
Okay. So this is not something you recommend to do. You'd rather just do the IVF procedure from the beginning.
100%. And if you have blocked, if I even tell my patients that have one fallopian tube that's working, usually the other fallopian tube has a major problem, whether it was from an infection or something that's going on in the pelvis, there's a very good chance that the other fallopian tube that is still open may have a problem as well, but in the earlier stages. So you have to be very cautious, even when getting pregnant, when one fallopian tube is majorly damaged and the other one is really unknown.
Okay. So
I'm not saying to avoid pregnancy, but just to be very careful once you're pregnant.
Another thing, there are some things that cause, they say, infertility, which is, of course, STDs. And they say that other things that cause infertility is also, what do they call, polycystic ovaries. Is this true? Or
so
tell us what some of the things that are...
let's talk about those individually. Okay. Let's talk about polycystic ovarian syndrome, PCOS, because PCOS is the situation where someone has a little bit extra male hormone in their body. The extra male hormone does not allow them to ovulate very regularly. Many of these patients are overweight, and being overweight actually makes the entire system worse. But these days, we're seeing a lot of patients that have PCOS that are not overweight and still have the excess male hormone. By that, we mean like extra hair on the chin, extra hair on the areas that a woman should not be having. The mustache area is not really counted in this area because for many of our females that live in parts of the world like we are from, it's normal to have a little bit hairier upper lip. And
we're a bit hairy.
But when it starts to become, like male pattern baldness and hair on the chin affects your period and you're not getting periods regularly, when you're getting a little bit of darkening around the neck or under the armpit, under the breast, the inner thighs, that's not dirty. That's the signal that someone's insulin is not working well. Acanthosis nigricans, it's what it's called. And that's a signal to us that PCOS is not doing so well. So with all of that being said, polycystic ovary syndrome, the number one, and I did my thesis in this area with one of the world's biggest PCOS. He used to be the chairman at Cedars-Sinai Hospital when I was a fellow there. So I did my thesis in the area. And we saw that as a result of doing, weight loss, just weight loss if you were overweight, was the number one thing you could do to cure. The other thing was not cure, but it never goes away, but you can get it completely under control. Some other medications like metformin or glucophage may be very good in helping someone's insulin work better. It'll help them potentially even lose weight better. And those things can help polycystic ovary syndrome. And also ovulation medications like Clomid, or letrozole. They're pills you take for 5 days that help you ovulate better. Those may be the answer. Talking about I'm sorry.
How do you get diagnosed for PCOS? A question. How do you get diagnosed?
So you need to see a specialist that knows how to diagnose it. There are different things that they look at, and you do not have, and I just saw that question. I'm sorry, I didn't notice it a second ago.
No.
So if you do an ultrasound and the ovary has all the way around it little cysts, and they're in like a ring formation, that's called polycystic ovary syndrome looking ovary. Okay, so the ovary looks polycystic. That's one. Two, if you have excess male hormone, whether it's on a blood test with a high testosterone or exactly what we talked about, just the signals of it, like the little hairs on the chin, male pattern baldness, hair on the body excessively, that's another one. And then the other one is potentially not having a very good ovulation and having very irregular periods. So in many parts of the world, the diagnosis, if you have just two of these things, you have the diagnosis of polycystic ovary syndrome. But it's a major spectrum. There may be someone that looks absolutely normal and you could never tell from far away if they have that problem, or it may be someone from a mile away with male pattern baldness, acne, hair on the chin, obesity, darkness around the neck, and if you ask them about their period, it's irregular. Those are the people that you can tell from a mile away. Okay. The number of little follicles, okay,
You
I'm
got
just
one
looking.
before about DNA fragmentation affecting sperm quality. I didn't understand the question. I'm sure
So
you do.
I understand that, so I'll definitely answer it. The polycystic ovary syndrome can be better controlled. So if you think you have it, you should definitely see a therapist. You are welcome to call my office, send me your labs. We'll do the consultation by phone, and then every couple of months we'll have follow-up. I actually, when the borders were open, I had amazing, lovely young Kuwaiti a college student that would see me on a regular basis, and we got her PCOS under such excellent control while she was living here in the
Amazing.
US. You said one other thing. It was PCOS, and then you said something about...
Yes, here, this question you got. What's your advice to a man with DNA fragmentation affecting sperm quality?
Okay, so anyone who has a sperm chromatin structure assay that shows they have significant fragmentation, basically in English, okay,
Yeah.
it means that if your sperm behind the scenes, the DNA, the genetics behind it is really damaged, okay, what are the things you can do? First of all, those people a lot of times have a situation called Varicoceles, which are thickened veins that take too much blood to the testicle. That excessive heat of too much blood at the testicular level can cause this DNA damage. Secondly, you need to make sure all of the things which, I love my home side of the world, but smoking. Smoking causes significant damage to sperm, and I think that many more men in the Middle East are smoking than people in the West. So
Yeah,
that's
it's
another
still
thing.
very it hasn't gotten less than before. Okay, a bit less, but still it's
Here it's
very
gotten
available.
significantly less. Rarely do I ever have a patient that smokes anymore. It's like a rare thing here now.
It's
But I
it's not a trend anymore, but it's still there in our part of the world. But it's
right.
not as bad as it used to be, but it's still there.
I understand. So that is something that smoking can really hurt. An antioxidant such as CoQ10 is really important for reducing sperm chromatin damage. The purest form of the CoQ10, which is called ubiquinol, when taken 200 milligrams a day, helps men reduce the oxidative damage and the damage to the DNA. So I would highly recommend it. Anything that has excessive heat, like steam rooms, saunas, jacuzzis, extremely tight underwear, extremely tight jeans, having a lot of spinning or cycling classes and things like that, those can all hurt testicular sperm quality. So those are things that easily a man can do to help things out. And taking the antioxidants and seeing if they have varicoceles is important. But sometimes, with all of that being said, the easiest and best way to fix this, okay, is to be able to pick the sperm out from when we do the IVF procedure under a microscope, pick the best looking one and inject it into the egg. And that's
And
called,
this is done, of course, through IVF, obviously.
that's through IVF,
Yeah.
yes.
Okay.
Yeah.
So we started with PCOS first. What's the second topic we're going to talk about now?
So I think the number one cause of infertility for women in my part of the world, and I am assuming soon will be in your part of the world, is age-related. So as you get older, the chances of having a healthy pregnancy and a healthy egg just keep going down more and more and more and more. And as a result of that, we have women that are coming to our office again and again and have bigger problems. This is why being proactive and freezing the eggs, which is a simple procedure, I don't care what anyone says, but I think in places around the world where it's not as common, there are a lot of myths that go along with it. Usually we put someone on a birth control pill for about 10-15 days to stop their natural cycle so they don't ovulate. And then it's a procedure where for about 10 to 12 days, there's tiny, tiny needles that we teach you how to give yourself injections into your belly, okay? And then by the end of the 10 to 12 days, the eggs come out in a 3 to 5 minute procedure where you're completely breathing on your own. We just give you a little bit of sedation, which knocks you out in the operating room, and the eggs come out with a special needle that goes through. They are not cutting your body, sewing your body. They are not taking out all of your eggs. It is every time you ovulate, about 1,000 eggs die off in the process, and we are trying to recruit a handful, 2 handfuls, 3 handfuls of those eggs during that process of their death. So it is not going to put you into an earlier menopause. It is not going to do anything. And from everything that I've heard and read, and from all of my friends in the Middle East, I don't think in any way it's against Islamic law as well.
No, it's not. It's not. The only thing that's against Islamic law so far is surrogacy, because they don't consider that, like, I don't know. I don't think there's like an answer yet to that, but it's very common now to discuss freezing eggs, but it's still not very like open. Like there are like certain people talk about it, but I don't think it's something that's very common and discussed like it is in the States or abroad yet. It's very new. And
So
you know,
it sounds like where we were like 15 years ago in the United States.
Yeah. Like, why would she do that? Like, why would she go that far to do this? Hopefully she gets married next year. Like, you know, the idea of a woman not getting married is not very like, it's very far-fetched. Like, I got married at 32 and my mom was like so worried, like, you know, 32 married,
Believe
that's
me,
like a spinster in Saudi.
I understand all of this. I come from a world that everything is similar. From the
Yeah.
day I was born, when I used to see my grandmother, all she said to my sister and I is, "May I see your wedding? May I see your wedding? I hope I come to you and get married." And as I was going through medical school, I would hear my grandmother tell my mom, "He's getting older. He's not going to find a wife." So all of the things, I know exactly what you're talking about.
And when you got married, it's like, when are you going to have your baby? And after you had your first baby is when you're going to have your next baby. It's just like so similar.
Similar questions. I think it's the same handbook
Very.
that goes around the world.
I know. You got so many questions here, like, but a lot of them are personal. Like, how can you improve egg quality is one.
So to be really honest, you can't improve egg quality. You can improve your health, but for women, you are born with every single egg that you have for the rest of your life. Now, you cannot change those eggs tremendously. If you are really harming your body, like drugs and alcohol and being overweight, which is somehow really bad for female and male fertility, okay, which is controllable and you can do something about it, or you're not in good health, or you have high blood pressure, those things overall can affect your egg quality. But nothing is going to go back into your body and be like, oh, let me make that 40-year-old egg like a 22-year-old again. Doesn't happen. Sperm, you can regenerate again. Every 72 to 90 days, you can get brand new sperm, and you can definitely regenerate it.
And this is by improving like your quality of life with sperm.
For sperm, the healthier you get, you have an opportunity because it continues to regenerate to the day that you die. You're able to do so. Now, because of COVID and because of everything else in the world, we had such a gigantic rise in men freezing their sperm in the last year. There was a lot of unclear data about what COVID the virus can actually do to sperm well-being. There was a lot of myths about what it could do to egg quality. We're not really sure what it does to fertility, but these are all things that are incredibly nerve-wracking when you're not sure what really it can do, and the research is being done as we speak. But for that reason, to freeze a sperm is such an easy thing. We had thousands and thousands of men freeze their sperm over the last couple of months before the vaccine came out and right before getting concerned about it. You know, I'm loving how all of these questions are coming through.
I know you're getting so many questions. This is aside from my inbox that I'm getting so many questions, and my WhatsApp. Because some don't want to put their name. A question I wanted to ask you, I just forgot what is it. This one is about the AMH levels.
I wanted to answer a comment on that. You know, like 10, 15 years ago, we used to get patients. We used to have patients, you know, please don't tell my name to anyone. You know, I don't tell anyone's name to anyone. You know, but the fear that people had that someone may know that they had infertility. Infertility does not make you doing illegal drugs. It is one of those things that you have zero control over. And to be very, very honest, the idea that you may have egg quality that is not the best is not your fault in any way. And I want people to start learning to get away from this myth. The only thing that started to change things here in the US is that more and more well-known people started to talk about their infertility. And then millions of people that were silent and quiet and hurting inside realized that, you know, I'm not alone. And now it's become rather sought after and talked about. And now the egg freezing aspect has become something really cool. Oh, wow, she's smart and she can afford it and she can do it. And she went to the best clinic to do it and she's talking about it. So it's becoming something. And I pray that in your part of the world, where our origins are from, that people start to be open-minded about this stuff. There's nothing wrong with people. Just because you decided to become maybe more educated or to build a career before moving on to these things does not make you, you know, a worse person that had to wait longer. But unfortunately, the body doesn't always listen to us when it comes to these things. And I really wanted to say that.
You know, one of the reasons I loved having you on my live today, because I remember like a lot of my friends have had kids through IVF, but it's a secret. Like even they don't tell anyone, like they would tell their best friend and they would share, but it's still not a topic that's discussed. Because, and I always think that you should share knowledge. Like if you found a really good doctor that helped you out, share the information, share the problem. But this is why I always use my platform as a way to share information. And I love the medical field. I think in another life I should have been a dermatologist, but I didn't know what I wanted to do in college, so I did business. So in general, so I love hosting doctors, if you notice, because I really enjoy this field. And I think it's so informative to have something that's very casual, where you can ask questions and just relate and have someone there to just answer you. Another thing I wanted to ask.
Oh, sorry. Go
ahead.
One of the things that we see a lot of patients also from the Middle East is for gender selection.
Yeah.
You know, I have 4 kids. My middle 2 are from IVF because we had a little bump in the road and we're not getting pregnant so easily after our first child, and we had a miscarriage as well. And then for 2 years, we didn't get pregnant. And when we had to do IVF, we chose a male and a female, and my twins just turned 9.
Oh,
so
that's nice.
I have a lot of people coming for gender selection that is done in a very safe way. Not only does it check for the gender, it also checks for Down syndrome and all chromosomal
genetic deficiency. Yeah, I heard.
Yes,
this.
and I was completely unaware, but I guess it makes sense. Unfortunately, there's a lot of, I want to call it inbreeding, when many cousins are getting married. And
we have that a lot in our part of the world.
Yeah. When the genetic abnormality that you're completely unaware that you even carry, but your cousin carries the same thing, then you have a very high chance of passing it on to your child. So this is another reason why we're seeing a lot of people from the Middle East as well.
In Saudi now, there's a law that for you to get married to a cousin or anybody you marry now, you have to do a blood test to check if you can actually marry that person, because there's a lot of issues regarding, you know, these marriages.
Right. So we do the genetic testing on everyone. It's about 283 different disorders that we check for. Many of them from people from Mediterranean and Middle Eastern backgrounds are all on there. If 2 people do carry the same disorder, we don't tell them that they cannot get married. You can get married, but then you have to do IVF, because with IVF, we're able to find that disease that you both carry. You will never have, you will never know you even have it in your system, but your child can actually have the disease. We're able to make an embryo, check it to see if it's a carrier like you, or if it is actually the diseased embryo, and make sure we don't transfer the diseased embryos back into your body.
Yeah. In Britain, they do IVF, but they don't choose the gender. This is why a lot of people like to come to the States, because they get to choose the gender.
Well, I do want to let you know that in Britain, the fertility treatments and the fertility clinics are way, way behind, and they don't know how to do the genetic testing really well.
In Britain.
Yeah. This was a very big shock to me when I found out that Australia and the UK were so incredibly behind us in the world of fertility, because we have anyone who's someone in the UK is coming to our clinic to do fertility treatments there. And when I went to the UK and I met with a lot of clinics, the things they were doing were like 12, 14 years behind us.
So it's delayed.
Very delayed, unfortunately. The quality of the IVF in those parts of the world are surprisingly behind. I know right now, for example, there are a lot of IVF clinics that have popped up in Dubai.
What do you think of those?
So I know some of the founders of those clinics, and I know many people that have been to those clinics. And, you know, Carolyn and I were talking about it because they're not doing it the same way. So, you know,
they need to come to your clinic there. Like I've noticed even so many doctors in LA, they're like, we need the patient to come here because the whole facility is here. Like I spoke with Dr. Teo a while ago, and he said that he needs someone to be present, that the facility is here. Do you feel the same way with you, or you can fly?
I was flying and doing consultations around the world, you know, everywhere. But or I was doing them by phone call or by. The problem is that I can't take my lab everywhere with me, and I can't take the lab, to be honest, anywhere with me. So eventually we can get you started, you know, the good thing for my patients in the UK is there's a lot of clinics there that were more than happy to help. So I would have them go and start the injections there. The nurse would call us and give us, email us the results immediately. And I would tell them what the next step is. And like about a week before the eggs came out, instead of having to be here for like 2-3 weeks, they would fly in, do the procedure and leave. And these days we make embryos, we freeze them all. We do the advanced genetic testing that takes up to 2 weeks. And we also it's been proven that the body does much better if we allow for your body to go to a more normal state before putting the embryo back. So we're doing all frozen embryo transfers, and that gives a higher success rate than a fresh embryo transfer. So you can come back a month later, 2 months later, 10 years later. I mean, you can do whatever you want later.
Okay, another question, doctor. This is something that I think every woman is going to ask you that's trying to get pregnant or is pregnant. Should she take the COVID vaccine or no? Because let's be honest.
Right.
There's no really, I don't know how to answer this. You tell me.
There's nothing. So I don't know how to answer it either. I was hoping you'd have
I don't believe that they tell you it's safe. When I keep reading it, and the last week they sent me this report, this lady in Britain was saying it is absolutely safe. How do you know it's safe? How do you know it won't affect the child? Because there's not one child that's been born after the vaccine. You know what I mean?
So you're absolutely right, and you're looking at this the right way. The problem here seems to be a couple of things. First of all the obstetricians and gynecologists that I talk to are even giving them to their pregnant patients. I would have a little concern taking a vaccine that I was very unfamiliar with while I was pregnant, but that's just me, okay? Getting it before pregnancy, there is no data out there, nothing at all that tells us anything. You said it better than anyone else could. However, I have one major concern. What other option is there? Okay, I don't know how it is living where you guys are, but if you want to have any chance of a life, and I do think, and last night I was talking to someone and they were telling me that their brother got COVID. He's younger than me. He was in the hospital for 1 month.
You don't know how it affects everyone. That's the thing. Yeah.
You don't know how it is going to affect you. You don't know if you're going to be one. And, you know, I have a friend of mine who had it and called me and said, the worst thing was not, you know, my congestion, my fever, my sweats. The worst thing is the psychological aspect of what the media has made of COVID, not knowing what it's going to do to you. So, for example, you get COVID, you're probably going to just be fine. 99.9% of the people are fine. It's mild and it goes on. But you did that fear of not knowing if you're going to be that young person that was healthy that suddenly is going to die or get hospitalized for a month. That's scary. And this is the other thing. You just don't know if you get pregnant and you suddenly got it. Is it going to, you know, the effects of that could be much, much worse than a vaccine. So I got the vaccination. I was scared. At first, I thought I wasn't. Then I sat with myself and thought, what other option do I have if I want to get my life back? So it's a way of looking at it. You know, if you have what's your option? If you're a homebody and you're fine being home all the time and not going places and doing anything, don't get it. But if you want to get any part of your life back and be able to do it in a safe way, it's a different story.
True. Here they're vaccinating a lot. Saudi and Kuwait, they're vaccinating a lot. And Dubai has a very high rate of vaccination. So hopefully in the next 5 months, there will be a very big percentage of our part of the world vaccinated. So, and I think they're going to allow travel or like certain things only with the passport, a COVID passport very soon. I don't know how long. But
we've heard a lot about this too. And you know, the vaccinations are growing here very quickly, very quickly. They can't even keep up with all the people that want them.
Same.
But they're coming out so fast, and people are just trying to do everything they can to get the vaccination. I feel so fortunate that I was able to get the vaccine myself, and that it gave, you know, some aspect of being normal back again.
Of course, it's honestly been a very tough year and a half. Honestly, I'm so ready for this to be over. Really.
You know what? Every single person in this world is in this together. Just when we think we had it horrible, when I think about the countries whose lives revolved around tourism, and the country has been closed for 1 year, and the suffering that people have financially had because of the loss of income for them. I mean, it's devastating. And just just when we think that our life is horrible and it was awful and not going to parties and seeing our friends and weddings of 800 people, you know, is this missing? I think about, and it pops up in my life about places that have just been completely shut down and how people have suffered financially. So we got to still count our blessings on a daily basis.
So true. I wanted to talk to you about something else other than pregnancy and infertility. There are a lot of women that have infertility for no reason. Like when they go to many doctors and they tell them that there's nothing wrong with you, the male and the female. Is that true, or there's always an answer for each one?
So that's called unexplained infertility, and it's rather true. So about 20% of overall fertility is unexplained infertility, when they can't figure why the man and the woman. Now, I have to tell you personally, I've had many, many people come to me and say they don't know why they're not getting pregnant, and their doctor couldn't figure it out. And with a few blood tests, we figured it out really quickly. So I have to say, I think many people are going to clinics that don't have the facilities and the knowledge of how to really diagnose these issues. That's one thing. And the other thing I think is that sometimes people are waiting they're like 43 years old and the doctor's like, you're great and he's great. You're not great when you're 43 years old. Every single woman's fertility goes down with age significantly, and you may be that 36-year-old that has already gone down significantly, or you may be that 38-year-old that already egg quality is really poor. So if you're getting, and the treatment for unexplained infertility is IVF. Yeah. Because in the lab and under the microscope, we can see your egg and we can see how it's doing, and we can give you a lot of information back.
Okay. Doctor, a lot of people are asking here in my inbox, how much does IVF usually cost?
It varies. It really varies because we're not one of those clinics that has like a packet that you just pay a packet. Yeah. You know, if you want to use our newest incubator in the world, that's about a $450,000 machine called an embryoscope, and it only holds certain number of embryos of people, not everyone's, you know, there's like a fee for that. If you want to do genetic testing on your embryos, there's a fee for that. If we're going to take your sperm and find the best sperm and wash it and put it under some testing and put the best sperm in with ICSI and intracytoplasmic sperm injection, there's a fee for that. So I'm really the worst person to discuss this, but it's going to be something around $15,000 to $25,000.
Okay, that's similar to our part of the world, and with all this, it sounds not bad.
Listen, I think it's pretty much there. I think when you're finding countries like Cyprus and places that are doing this for these dirt cheap prices, I've yet to see one person come back pregnant from one of these clinics in these countries that are doing these discounted pricing. It's
not a package deal. These things don't come as a package deal. You can't cheapen out on certain things. I always say with medical care, you cannot go find the package deal. It's not a hotel and a package or a tourist destination. This is your body, you know.
So I tell everyone, when it comes to eye surgery and fertility treatment, and the list can go on, there's some things you may want to pay more for. Okay, I'm all about a good deal. You know, I'm all about
me too, but certain things.
But not on my health. And I cannot tell you, here in LA alone, okay, there's some doctors that have much, much lower prices than ours, that have much smaller offices and very small laboratories. I can't tell you what percentage of my patients are people that have done 3 to 6 cycles in those clinics, have failed. They thought they were going to save money, but now they spent much more money than if they would have come to us the first time.
From the first time. True.
Yes.
Another thing I want to talk to you about is menopause. This is something a lot of women, of course, go through. And of course, this is something also that is not discussed. And after menopause, you notice like a lot of women have issues with their ovaries. They have issues with bleeding, or it starts, I don't know, these issues happen. So tell us more about that aspect, because this is happening a lot in Saudi. There, she has to remove her ovaries, and
well, I'm going to be very honest, my dear. I am a reproductive endocrinologist and infertility specialist. Okay.
Yeah.
So as a reproductive endocrinologist, I help all hormonal aspects and problems that could be affecting reproduction, and I don't really treat too many menopausal patients. Okay. However, I can tell you right now that there are a million myths about menopause, okay? It's something that no one can stop. Everyone will go through it. And I think it's really becoming a deep variety of what age people are getting menopause in.
Yeah.
We have, after the age of 41, it's not even considered premature anymore. So what I mean by that is that if you're 42 years old and you go into menopause, it's considered to be normal these days.
42?
So
Isn't that too early?
No. Anything over the age of 41 is not considered premature ovarian failure or premature menopause.
Okay.
So anywhere in the 40s is normal. Now, the average age in the USA is 51.
51. Okay.
And after the age of 51, the benefit of having an ovary is really nothing.
It's no benefit. This is why most people remove the ovaries after a certain age.
You know, I don't know if everyone needs to remove it, but if there's a cyst, if there's something that could be, you know, the beginning of a cancer or something that's worrisome, I would follow the instruction of your oncologist and make sure that you're doing the right thing.
Okay, another thing, we got a question before that I didn't answer. It was about bleeding. Women that bleed excessively for long periods of time after their period and just continue bleeding. What is this? Is this a cause of course
it could be many things. It could be many things. It could be fibroids in the lining, which are muscle balls that grow in the lining of your uterus that don't allow, once the period goes, for it to control the bleeding, and you continue and continue. It can be polyps, which are benign tissues that grow inside of the uterus. It could be it could be a blood clotting factor. So you have something wrong with some of the factors in your blood. It could be thyroid. It can be so many different things. I think at this moment, it's important to get complete physical exam by your general doctor and also your gynecologist.
Okay. You have a question here that's interesting. Any treatment for azoospermia when 99% of the sperms are dead?
Yes, we use the 1% that's healthy or the 1% that's alive. Azoospermia means zero sperm. So actually, if you're making sperm and 99% of it is not alive, you don't have azoospermia. Now, in a situation like that, we do many different procedures, and we've had many men from the Middle East come and do this with us, where our urology colleague actually goes into the testicle and removes fresh sperm, and it's called TESE. TESE. The TESE procedure, which is the testicular extraction of sperm, is the #1 way to remove sperm and use in an IVF procedure for someone that has very poor sperm. We have the urology colleague do that for the male in one operating room, and then we do the female procedure in the next room next to each other.
So basically, there must be something out of this sperm that would actually work. It's not like the whole batch would be...
Well, once in a blue moon, we go into the testicle to find sperm for someone who has no sperm, and we still find no sperm. But I got to tell you, it's usually very uncommon.
Very uncommon.
Yes.
You have a question here. Can I be a candidate for IVF if I'm overweight?
So if your BMI, your body mass index, is over 35, and you can calculate it, if you just Google BMI calculator on Google and put in your weight, it'll tell you what your BMI is. If your BMI is over 35, we ask that you lose weight first, because it becomes very complicated if during the egg retrieval you have some excessive bleeding and someone is very overweight to try to, if there's a complication and you're overweight, it becomes a major problem. And also, egg quality starts to go down significantly because of overweight. So we want everyone to have a BMI of less than 35 for my clinic.
Okay, this is another question you have here. Can you ask if someone has having regular periods, but her follicles didn't see, her follicles are not seen in the scan at the 12th day of the period?
Okay, so basically, 99% of women with very regular periods, okay, have the egg is going to be big and ready to ovulate around day 11, 12, 13, because most people average ovulation is on day 14. So if you go in on day 12 and there's no follicle, there's a chance that you're ovulating very early, or there's a chance you're ovulating very late, and that's why they didn't see it. You should use an ovulation predictor kit where you test your urine every morning and see if that works, or go in for more often for the ultrasound.
Okay, there's another question. Doctor, my husband's ulcerative colitis.
Yeah, ulcerative colitis. So ulcerative colitis is not something that you can test for in a human being and make sure that it does not get passed to your baby.
Okay. There's another question about the egg quality here. What is the cause of my menses skipping months, and what is the treatment for that?
It could be many things. It could be many things. It could be abnormalities in thyroid. It could be abnormalities with a prolactin hormone. It could be that you're almost menopausal. It could be that you have very little eggs and that age of perimenopause is hit. I mean, it could be that you're very overweight and you're having irregular ovulations, or it could be that you have polycystic ovary syndrome. These are things that you can't just get an answer something like this here, and you need thorough workups.
Yeah. Doctor, do you recommend you say it.
Adhesiolysis for someone who has had an ectopic and is left with one tube, even if the adhesions are around the ovary? I would never do that. I think it sets you up for ectopic pregnancy again. I think it's much safer to do IVF.
Okay. Freezing eggs at 42?
It depends. I have had 44-year-old patient that I froze 2 eggs on and had a beautiful baby when she was 47. I have had 38-year-old that I froze 30 eggs, and all her eggs when she came to use them were not good enough. So in my opinion, if it was my sister or my wife, I would say it's better to freeze 1 egg than have no egg.
So 42 is considered a bit late. So you'd recommend at what age? What's the ideal age for freezing?
Ideal age is different. I think any woman who turns 30 and does not have a ring on her finger and is not about to try to conceive should either be freezing her eggs, or even if she's married, so important, just because you're married and have a man now, but you're waiting, it's not protecting your fertility. So at that point, we have a lot of couples that come in and do what's called embryo freezing. They put the egg and the sperm together. I have a lot of young lawyers, a lot of young business couples that are both just ready to take off in their careers. They come in, we get her eggs. She has a man in her life. We put the sperm, we put it together, okay? We put it together and we make the embryos. So many people, by the way, have been asking where I'm located. If you go to my Instagram, if you go to my Instagram page, you will see all of the information from my clinic. We're in Los Angeles, California, in the United States.
He's in the US.
Yes.
You know, it's funny. I always get this question, even though I always say where you're from and everything before, but they ask.
No, I always get it too from people messaging me on my Instagram page. Are you in Nigeria? Are you? If you just go to the front page.
I know they don't read. I've noticed people don't read on Instagram. You have a question here that's cool. 34 and trying to conceive, and periods recently became irregular. All test results look normal. What would you suggest?
I would suggest you do another checkup with another doctor. Make sure it's as thorough, and because something is being missed, there's something being missed there. There's something being missed.
Okay. So doctor, what if someone would like to contact you? Like, we have just 4 minutes left. So if someone wants to start a program and like they want to start dealing with you and they're actually here, you can deal with a clinic here and tell them what to do in terms of tests. Just tell me how we can go.
So if you have a fertility clinic near you, you can always call them and say, do you do outside monitoring? I'm going to a clinic in the United States, but I'd like to do some of the procedure here. Are you willing to do outside monitoring for the other clinic and send them my results here? All reputable clinics. I do outside monitoring for patients that are like New York based, but they're in LA for work. You know, I do that all the time. And I have a lot of friends in New York and in different parts of the entire world that do them for us as well. So that's the first thing. But before that, you have to set up a consultation by phone or by video chat. We do them mostly by phone. It's just easier. And we set everything up so that we make sure that people are doing well and they know exactly what they need to do next.
Question, in the Middle East, do you have any clinics you deal with yet or not yet? Like Saudi Arabia and Kuwait and Dubai, or not yet?
So I have had many. There's not one that rolls off the top of my tongue, but there are clinics. There is, right now, I am speaking to a clinic in Dubai that really wants to work with me. and to have they have tons of patients that they're trying to get through to us. So we may be going to Dubai to do consultations there. I'm not sure. It's very difficult for me right now. I think it's just easier to do everyone's consultations by phone, give them information, allow them to find a local clinic close to their home that's willing to help, and go from there.
Okay.
But
in
by the
general,
way,
all the lab work has to be done in the States, all the lab work.
So not all of the lab work. Certain blood work, like your sexually transmitted diseases, they must legally be done in the United States, not even UK or any of it has to be done in the US. But just your normal checkups to see how you're coming along can be done anywhere.
We should have talked about STDs. We didn't have time for that. But
we
next
have so
time.
much to talk about.
We have another live. We'll do it again. By the way, when I do one live with a doctor, it doesn't mean it's the end. We have another live coming up soon, but we can choose a different topic.
It's just the beginning. It's just
yes,
the beginning.
Whenever you're free, just let me know and choose the topic, and we'll definitely do it again. I always say, by the way, I'm an investment banker. That's my original job. And then after that, I left, and this influencing thing came as a coincidence. So I said, as long as I have this public platform, I don't want it to be fluff and shallow. I want it to be deep, and I want it to have information. So what I want to do is I just don't want to keep talking about junk every day, because I need to basically share information. And for me to share information, I can't talk about things I don't know. So I host people that have the knowledge to basically share, like you today.
You know what? A smart person is someone who's continuously learning. I can tell that you are absolutely amazing.
Thank you so much.
I have really enjoyed this.
Me too.
I'm so sorry that I could not have done this in Arabic. That is
no, it's fine. It's fine. I'll explain later. But by the way, the majority of my followers, to be honest, speak fluent English.
I'm sure.
So,
but I was my sorrow that I wanted to be. I tell my friends I've been friends with since I was 6 years old. I said, "What kind of a friend are you?" I still don't speak Arabic. So that's my sad here.
No worries. It's okay. And I actually talk about this. I always put clips of this on my Snapchat, which was mostly Arabic speakers. And I explain the concept. And trust me, if people want to reach you, they're going to find a translator.
By the way, we have my patient experience supervisor in my office is Egyptian and speaks Arabic fluently. And she can translate. We have all kinds of translation services for people, and everyone has a friend that can translate for them as well. We can help with every aspect of this if we needed to. So I don't want anyone to be worried. I wanted to just let everyone know of one final thing before I have to say goodbye, is that if you go to our website, which is scrcivf.com, that's Southern California Reproductive Center, IVF.com. If you go there, you can sign up for our patient educational seminars. We used to do this in a big auditorium locally. I don't know why we never thought about doing it by Zoom, because now we have hundreds of people every month when we do these watching our seminars and learning, and it's completely free. So you are more than welcome to follow along the Instagram page. We have a YouTube channel that I have that is very educational, and I put all of these things up there. And I cannot wait now to have you on my podcast.
Definitely, I will soon.
It's called The Fertile Life, and it's just began. We started to record our first couple last week. So The Fertile Life will be up very soon, and it's going to be a lot of fun, and I can't wait to host you there.
Same here.
And it's been truly an absolute pleasure talking to you, my dear.
Same here, and hope to do it again soon with a different topic. We have a lot to talk about for sure. And see you soon.